Your role and main day-to-day activities?
Sure. So I'm a clinical hematology oncology pharmacist at a large 900-bed medical institution. We're a cancer center as well as other things located in, and now this is not blinded, correct? I don't have to not tell you anything?
Sorry?
So this is not a blinded conversation, is that correct?
That's correct.
Okay. So I work at Northwestern Medicine in downtown Chicago. Like I said, it's a large institution. We have about 5 different satellites across the Chicagoland area.
Mm-hmm.
I guess we have our hand in different national guidelines, especially, like I said, my specialty is cancer, so NCCN guidelines, and we're at a National Cancer Institute. What else did you want to know?
What are your main day-to-day activities?
So my main day-to-day activities kind of differ depending on which hat I'm wearing. And
Yeah.
So I'm a clinical pharmacist, so depending on which clinic I'm in will kind of shape that. So we've got different ambulatory care clinics that I can be in on any given day, and my role in them is slightly different, but kind of the same in terms of seeing patients, educating patients, and providing clinical support to providers, nurses, mid-levels, as well as verifying orders and seeing to the actual production of these drugs. So that, like an infusion clinic. And then on the inpatient side, it's kind of the same, where it might involve some type of clinical rounds, and then seeing towards the actual preparation of the drugs and dispensation of those drugs inpatient. I'm also involved in our sorry, I can't speak.
Don't worry.
Oh my God, research department. I can say that. And so phase 1, phase 2, phase 3 clinical trial setup.
Yeah.
And I've been doing that for a couple of years. Also it's not devoted to oncology, but because of my specialty, I tend to get more of the oncology specialty type studies to set up.
Mm-hmm.
So that's in a nutshell kind of what I do. So
Yeah.
it's a healthy split between patient interaction and maybe about 30% other tasks, administrative or research related.
Mm-hmm. And what would you say, and we'll go in depth a little bit later, but overall, what are your biggest, or what is your biggest challenge in your day-to-day work?
Honestly, my biggest challenge is logistics from us being such a large institution and having to coordinate with decisions that are being made on like those other 5 satellites and management, like middle management, over, I guess, their decisions that affect my workflows and overall ability to operate efficiently in a clinic setting.
Okay. And so you already mentioned in the questionnaire that you have interaction with blood plasma products. Do you have any specific challenges at the clinic for blood plasma products?
I mean, these days the new thing is going to be biosimilars and, cheaper acquisition costs and whatnot for those blood products. So are you talking about specifically like IVIG or like ever more encompassing other things like monoclonal antibodies and like GCSF and things like that?
I would say more on the side of IVIG, albumin, those kind of the bigger ones.
Oh, okay, yeah. Probably the type of products that we have in terms of, I guess for IVIG, we've had like 2 competing brands that we've decided to stick with, and so the supply is always an issue, making sure we have the correct supply for the right clinic, and whether, the logistics are a little bit different between inpatient and outpatient.
Yeah.
Where inpatient is more of like a cost savings center, and outpatient, it really depends on the the reimbursement that we're getting from that specific patient's insurance.
Mm-hmm.
So I think, what products are available, what products we're stocking, so supply.
Yeah. Yeah. Okay. As I just said, I'd like to go a little bit more in depth on some of the needs and challenges, and I'd like to do this using the support material I've sent you. In the support material I've sent you, we have tried to make a general depiction of the customer journey of a hospital pharmacist. In the bottom part, this is a graph describing different steps and processes along their customer journey. And I like to go sort of in blocks, so treatment knowledge being the first block, treatment purchase being the second block. And I'd like you to take a look and see and identify at which of the steps or processes you encounter unmet needs or big challenges.
I mean, probably right at the first part, aware of the products.
Uh-huh.
So, there's a lot of these products, and so knowing the pros and cons for something entering the market relative to what's already on the market, I guess is a gap.
Yeah.
Because sometimes we don't know,
Mm-hmm.
or at least we have to invest a significant amount of our own resources to kind of research that. And then contracting, usually when we bring so we get from the beginning of step one to the end of step one, which is the P&T,
Yeah.
In the middle somewhere, there's some type of contracting discussion with the manufacturer, and then an actual budget impact analysis on our end to see exactly where we'd end up, or at least where we think we'd end up financially.
Yeah.
So I think there's a lot of work to be done in number one.
And how do you think, or what is necessary to improve becoming aware of new products?
I think that it's not uniform in terms of how we find out about these products. So, for instance, if a new product is coming to market, we might hear a lot of buzz and professional conferences, but we do rely pretty heavily on advertisements from different drug companies just to know that something is coming out in the market so we can start this process. And that's not necessarily consistent. So some products might come out with little to no advertisement, we just don't know about them, or we might hear about them, but it's just not consistent how, there's not an all-encompassing forum where we can just go and see these things. At the FDA, I guess, is the closest source where we'll get, updates on what's being approved and whatnot, but even then, it's, to look specifically for a blood product in there is, you can kind of lose it. You might not necessarily see it when it comes by.
Yeah. And so, if you would think of a solution, would it be for example, another website, or would you like all these companies to send you an email every time they have a minor improvement or a new thing in their products? What would be, because I understand that you like to know everything, but I also understand that already there's so much paperwork and information coming in that it might be difficult to be overloaded with even more information. So what do you think is the best solution for you?
I think that, just the company's own due diligence, just to send out those communications, even if we, misplace it or can't look at it at the moment, I think would be nice, so that they've at least done that initial outreach, whether it's a mailer or whether it's an email or whatnot. And then for them to probably go to, some type of organization like AMCP is a good one, because they already have an electronic dossier system set up where, if I'm evaluating products, I can go on there and I can request an unsolicited amount of evidence and, essentially a pitch on why I should use their product or not. And then the AMCP, Academy of Managed Care Pharmacy, will actually, if I request one, they'll suggest, a whole bunch of other ones that are related to that product. So it's kind of, in a way, leading me to know what's available, what's not available, when I'm trying to do, say, a class review or something like that.
Yeah.
So, that's the start. We really like the AMCP system.
Yeah. And
clinical guidelines would probably be next if, there's